afternoon. I'd like to thank Lower Cape Cable TV for hosting our program today and allowing us to tell you about a very important community event that's going to take place on this Thursday evening at the Nauset Regional High School. This is a community education event for both parents and children, and we hope you will come. It's going to be watching the film If Only, that was created by James Wahlberg and sponsored by Millennium Health, Recovery Centers of America, and the Wahlberg Youth Foundation. And it's to discuss addiction and recovery and to recognize early warning signs and the need for early intervention. I have some great people here this afternoon with me. Right here is Rachel Tinney. She's the president of the local community action group, the Open Doorway of Cape Cod. Anita Devlin, who's come in from New York but raised her family here on the Cape, who is the author with her son, co-wrote the book Sober, a wonderful book that everybody should read on the topic. And Stephanie Van Winkle, guidance counselor here at Nauset Regional High School. So just to start off, I work in family medicine here on the Cape for many years and probably have seen many of the students here for health physicals. Also have been active in advocacy groups here on the Cape and traveling to Boston and Washington to work on policy changes to deal with addiction and treatment and recovery. I'm also representing families of loss as a mother who's lost a child to heroin addiction. I first saw this film last year. I thought it had a very potent message for families, and of all the documentary films and other films out there right now on the topic, I find it's one that's very reasonable for families to watch together, especially parents and children, especially in the age group that it's targeted for, which is early teens, 12, 13, 14, 15-year-olds, because a lot of the other films are for an older audience and a little bit more gritty and hard to watch, I think. So this film, which the writer-director was very sensitive about, was making a film that families could watch together comfortably and hopefully open up conversation and communication about a very sensitive topic for some families. So that's what we're about, and we hope to have a full house in our auditorium here at the high school on Thursday evening. There is free registration for free tickets. It costs nothing to come. Doors will open at 6 o'clock, and you can sign up at just Open Doorway at .eventbrite.com. But you do not have to not come because you don't have a ticket. Just show up. 6 o'clock, doors will open Thursday evening. So Rachel, I'm going to ask you to tell the community a bit about the Open Doorway of Cape Cod.
Sure. I'm Rachel. The Open Doorway of Cape Cod started a little over a year ago in March. It was because my brother Josiah Tinney died at the age of 26 of a heroin overdose in December of 2014. And my family and his close friends decided we didn't want him to die in vain. So we started an organization to help people suffering from addiction to get help that they need. Josiah fell through the cracks. The system is flawed, and he was waiting for insurance to kick in to get help, and it came 3 days too late. So we don't want that to happen. So when we say we help people, we don't just refer them out to someone and that's it. We wash our hands of it. No. We start from the beginning or whatever stage they're in. We get them in sober living afterwards. We follow them. We get them with counseling, outpatient, whatever they need. And we track them. When they're in treatment, we're calling to talk to their counselor, to talk to their case manager, and we're following them. So, there's a lot of places that say, oh, I've helped thousands, and that's great. But when we say that we help someone, we help them. We never stop. Basically, we never stop. And we've helped over 130 people in a year. And that, to me, is very emotional. Sorry, because when we started, I said to my brother's best friend, Shelley, who's the vice president of the organization, I said, if we can just help one person, it will all be worth it. And we've helped over 130.
Wow. That's amazing.
We do need donations. That's our big thing. And we need people in the community to just say, how can I help? We just need time. If you don't even have money to donate, that's fine. And when we say we need donations, we don't need exuberant amounts. I mean, we do, but, but you know, if you have $10, $5, whatever you have, it all adds up and it all helps. Our services are 100% free. We don't charge for a thing. You know, where we get you into treatment, that depends on insurance and everything, but we'll help you get insurance. We'll help find scholarships, and the money that we raise for fundraisers, we put towards the people who don't have the money. And let's face it, the problem in this country is that most people don't have the money, and they don't have the insurance that the medical field will cover for addiction, and that's the problem. So we're working with policies, we're trying to get grants, we're trying to do it all, and it's just a handful of us. You know, and it's not, you know, I'm the CEO, but we're not bigwigs. We're just a group of normal people on Cape Cod who are trying to do something and make a difference. Joan started, you know, she wanted to screen this film. It was a big thing for her. And the Open Doorway is sponsoring it, and we're really proud to do that, to bring it to the community. It's really important, especially for the young people, that heroin, I mean, heroin targets, it has no discrimination, it targets anyone, but the majority of people that it's targeting are our young people. And it's really important to teach them at a young age, you know, what to look out for, be careful, and to teach the parents. It's important that it's a family event because the parents need to know what the symptoms are. And, you know, like my mother, a lot of times you see things, you feel uneasy about it, but they can talk their way out of it and you believe them because you love them, and that's what you do. You don't want to accept it. And it's important that families come together and understand, you know, the whole of it. This affects everybody. You can find us on, we just opened our website. It's still under construction, but we've brought it live, and it's the opendoorofcapecod.org. You can find us on Facebook at facebook.opendoorscapecod. And you can email us at theopendoorofcapecod@gmail.com. And we have a phone number, toll-free, 844-the-ODCC for the Open Doorway of Cape Cod. And we're here to help. We'll get you in treatment, we'll get you in sober living, we'll just talk to you, we'll do interventions, we help with sectioning, we help with all kinds of things, people who are having legal issues. We'll try and guide you in the right direction. So, yeah.
And some of the other things the Open Door has done is provide people with food and clothing, emergency living expense. It's really been incredible what some volunteers basically have done working on a very small budget. You want to tell us about some of the money-raising activities that were done this past year?
Yes, this past year we did a big circus-themed tag sale event in the summer, and we're going to be doing that again. We think we're aiming for June, and it's going to be a big event, family event, so while the parents are shopping, the kids can play little circus games and things like that. And like I said, all of our money goes to, everybody on our staff works for free. It's all voluntary. So, you know, it's all free, so that means we need the money to be able to provide. So all of the money goes towards helping people get the help that they need. We've done a relay race with Chris Santos this past summer. That was a lot of fun. I don't know if you want to talk about that a little bit because you were working with Chris a lot.
Yeah, we did the Purple Flag Run relay race from the canal all the way to Provincetown the end of September last year, raising awareness. It was a relay race carrying the purple flags, which represent recovery from addiction, and they were carried by runners through every town on the Cape and planted either on town hall or police department property. And we plan to do it again later this fall, and hopefully we'll get some more corporate sponsors this year. The Open Door is a nonprofit 5013C, so if you're making donations, it's tax deductible. So segueing to you, Anita. Anita is a long-standing friend of mine, and unbeknownst to us, we were both suffering at the same time with children with addiction. Anita can talk a little bit about how isolating this substance abuse disorder can be for families sometimes, and part of our hope is to remove stigma and shame with the work that we do. So I'm very proud to have her here and to have her talk a little bit not only about the work she's doing independently of what we're doing here on the Cape, but also about her book, Sober, S-O-B-E-R, a story of addiction told by a mother and son. So welcome, Anita, and
Thank
please
you.
tell us a little bit about what you're doing.
Well, you know what's really interesting that you just said about we were going through it at the same time, but much like the film, we were two very different mothers, because Joan was head on dealing with it. I was still, my son was in high school, and I was in complete denial. I was in denial, or I was blaming everyone else. It was his friends. It was never my son. I was always looking past my son, never looking at him. So it was a few years later when I reached back out to you, and I just want to say something on behalf of all of us. The two of you and other people that have lost, that are out there doing what you're doing, the warriors, the ones that need the sympathy, the compassion, the empathy, the everything, the support. You guys are out there tirelessly fighting for other people's children. And, you know, my anger comes towards, I work with parents. I do one-on-one advocate work with parents, because I take what I've learned. When I was that mother in denial and blaming everyone else, I could have lost my son because I wasn't dealing with it. I was so petrified of everyone else finding out that my family wasn't perfect, that I was very busy keeping a secret. And so now I try to work with other parents, making them understand that it is indeed a family disease, illness, and you have to all be on the same page. It is not about ignoring it and thinking it'll go away. It's not about, even when you do admit it, setting your child off to, oh, they'll be fixed in 30 days, like they're dropping off their car to be serviced. I try to explain to them that long-term care, because you want recovery for life, not a little Band-Aid, but the whole family has to be on board. You can't let them go and think, oh, they'll come home and they'll be all fixed and come back to our family dynamics and all the people they were always around. It puts an awful lot of pressure on that one child that's going off to treatment. So I struggle every day with working with parents. Some of them are okay and they understand and they're on board, and some of them are not. And it's, you've got people that are out there judging, and you know, everyone's afraid of the judgment.
That's right.
But then you sit here and you listen to, I mean, Joan lost her son, and look what she does to help all these other people. How can you judge this?
Well, and there's not a family that hasn't been affected by it. Every family's been touched by it in some way or another. So how do you judge?
Exactly.
Well, it's interesting that you say that, because like when we go door to door to businesses or to people, and we just tell the story, we lost, you know, our brother or a son, or everybody starts saying, oh, I lost someone, you know, and it's like everybody keeps it bottled up and they don't want to talk about it because of the stigma. And I think that's what's really important about all of us, is that we're bringing it out and saying, talk about it, please, because we all need to help. We need to come back to being a community and helping each other with this problem.
I'm tired of the judgment, and I'm tired of people saying I'm unaware. Oh, what do you live, under a rock? I mean, you're unaware of what's going on, but I don't bother with those people anymore. You just have to just keep working with people that want the help and that need the help. And this film, to me, I mean, since my son and I wrote this book together, and I very much call myself out in the book and when I speak about, you know, I was as sick as my son because I was just so worried about everyone else. And everyone talks about enabling, and my son, I mean, recently, he's over 5 years sober, and I recently said to him, you know, we still talk about things, and I said to him, I'm really sorry that I enabled you for all those years. And he goes, you know, Mom, I was going to do drugs with or without my mother's help. You never enabled me. You disabled both of us because you were so petrified. You were the one that was sane enough to reach out for help, but you didn't until later on. So I disabled him from getting help, and myself.
Right.
I mean, we're all in recovery in my family now. You know, all of our recoveries are our own for what we went through and what happened. And you have to fight together and reunite as a family to get through, because that's the most important thing, is staying in recovery. This particular film, what I love about it, because since we wrote the book, what I was going to say is people send me videos and mini documentaries all the time. I have seen probably one every day for 3 years. This particular one, If Only, What I love about it, it's a family. And it's every day the things that people don't believe are happening. I deal a lot with suburban moms. I deal a lot with, very wealthy suburban moms in their big houses where everyone's saying, why is this happening? Why are our kids dying? Well, I'm going to say it. I find a lot of problems because I think a lot of times these are a lot of the parents that don't want, not my kid. So if only I knew. You do know. You're making believe it's not happening. If only I had listened to people guiding me. Back when I dealt with it when my son was in high school, no one was really talking about it. I mean, the school nurses thought the kids were all on steroids. Nobody said heroin or pills. So I, dragged him out and had him tested for steroids. I'm like, oh, he's fine. I don't know what's wrong with him. But you think about it that way, I mean, right? You know what I'm saying? It's very different back then. But now, especially on the Cape, I mean, I'm in New York, Connecticut, Rhode Island. I'm all over the place doing this. But on the Cape, there's so much support. I'm blown away by what's going on up here. Everyone offering help. People just need to show up.
That's it.
Yeah.
And they don't even want to do that. So, because they're afraid of people seeing them at the events. So, if only they can watch it, they can see the two moms. Which parent are you going to be?
Who do
The
you
one that's in
identify
denial
with?
with a glass of wine saying, don't talk about my kid? Or are you going to be the one that just grabs the bull by the horns and says, we're going to treatment?
That's right.
I really am in huge support of this, and I think that this is one that can actually be taken around the country into schools all over the place,
Yeah.
that people would accept it, the educators.
The younger, the better, too.
Oh, most definitely.
And I think you raise a really good point, too, is that this, if you're thinking who is the face of the addict today or the person suffering from substance abuse disorders, it's everybody. There's no one prototype, it's everybody. And unfortunately, the age group has dropped lower of first-time use. And that's why the largest death rate is happening right now in 22 to 25-year-olds, because these aren't people who just started using at 20, 25. These are people that
15.
started
That's
using
right.
13, 14, 15 in a very innocent way, and it got out of control. So Stephanie Van Winkle here at Guidance at Nauset Regional High School, what is the role of the school's support and help and resources available?
Well, we deal with it differently in some ways. I have been really fortunate. I've been at Nauset as their school adjustment counselor for 3 years, and I've had amazing support up from our principals, and not all schools do.
That's good, that's right.
But I had amazing support from Tom Conrad when he was here, and Ed McDonald, who's now our principal, and then our director of guidance, Dee Smith. They send me out to workshops. I get to learn about stuff. I get to bring different programs into the school. And it's been really a great learning experience for me. Our guidance department runs a little differently than a lot of the guidance departments on the Cape. We run as a triage. So these kids are coming into our guidance and they're meeting with their guidance counselors who are incredible, incredible people. And they're talking to them and then they decide, is it something that needs more of a licensed mental health counselor route, or is it something I can handle because there's only one of me and there's 5 of them. And a lot of times then that's when it comes to me. So this year, what we have tried to focus on, because this is near and dear to me, and I'm on the substance abuse task force that Nauset started this year, and we've had a plan for a year, and we've planned all the way out for 3 years and 5 years on what we can do as a community, because we're a big community. We have started the Project Purple, the Chris Herron Project Purple here. It just started this year, so it's starting slowly, but anytime anything new comes in, it is a little slow. So we're getting the kids to be okay with standing up for what they believe. And what we have decided as a group is what we're going to focus on is that we're good enough. Because as a school adjustment counselor, what I'm finding is these kids don't feel like they're good enough. And so a lot of times, it's easy to say that these kids are doing drugs just to party and have a good time. But a lot of times that's not the case. And a lot of times they had a soccer injury and they had to take pain meds, and the doctor gave them so many that it was awesome, and they got to play with it for a little while and they got hooked. They had a wisdom tooth out. So sometimes it's as innocent as that. I get, because I'm the school adjustment counselor, I get a lot of social emotional issues. These kids are self-medicating. Their anxiety, their depression at a level that I don't remember ever experiencing in high school. Anxiety and depression wasn't something we talked about. And it's a daily occurrence for these kids. And sometimes it's crippling. And instead of acknowledging that they have a mental health issue, or a lot of times it goes undiagnosed. So they are treating it with what they know. So that's a problem. I think we need to be more, we have to treat mental health like we would a medical issue. Because if we don't, we're never going to take care of this epidemic, because I think that's a big problem for a lot of these kids that are getting hooked on drugs. So we deal a lot with the triage part of it in the guidance department. We work on a lot of their social emotional stuff. We have the breakfast club that meets at 8 o'clock in the morning till 8:30, and we serve breakfast, and we talk, and we teach strategies on how to deal with their anxiety. Thank you. So that's something that we're really proud of. Like I said, we do the Project Purple. We bring in people like Joan to come and talk to our students so that they can understand, and not from a fearful way, but really an informative way, because sometimes I think when we come in and we smash them with the fear of it, like some of the documentaries that are out there, they turn it off because they don't believe it's real. They think it's drama. But when we can come in and be informative, that's a whole different ballgame. And I think when you left, that's what they heard, what you had to say, how it affected their brain, and how their brains are still developing, and how it can stunt it. I think that was huge for them. So that's something that Project Purple did. And I'm hoping that we can do more. I know that one of the other things that we have just signed up for is Gosnold will have an office in our school. And they'll be here once or twice a week. They're still narrowing out the details of that. But that'll be something that will be in another part of the campus that will allow some anonymity.
Privacy.
Yeah, because that's huge. So we're hoping that we're really trying. Both of my principals have been really big on not wanting to sweep it under the rug. It's like, this is an issue.
So lucky.
I am very lucky.
So lucky.
And I love this school department. I have been extremely lucky. They really want to deal with it. And it's not a Nauset problem. It's right now, it's a country problem.
It's a country problem.
It is a country problem. So I'm just really lucky that I've been supported, and I've been able to do the workshops that I need to do, and I can bring it back to our students, because we have amazing students, but we have a really rigorous curriculum too. So I think we really have to focus on their social emotional well-being.
And I think Chris Herron nailed it when I've listened to him speak a number of times, and one of the things he says to young people is, what is it about yourself that you're so uncomfortable with or don't like enough that you have to want to be somebody else on Friday night out in the woods?
That's right.
And so trying to help people identify what is the sense of distress or uncomfortableness that they have that makes them want to be something or somebody else. I think that's important to identify. And clearly we've got a large public health crisis, probably the one of this decade now, going on, where we had 47,000 lives lost last year. 47,000. We have now superseded the AIDS epidemic. We've superseded nearly the Vietnam War. We have superseded motor vehicle accidents as the leading cause of death in this age group. So this is something we really do need to seriously address, and it's moms and sisters and family members and schools and entire communities that need to come together to get the policy changes that we need, because policy change for better insurance coverage, for better care, involves people voting.
That's right. That's
voting for funds to pay for those things. And we can have all the bills we want that pass, but if they're not funded,
Forget it.
we're going nowhere. It's just a lot of talk.
Well, I think that's it. I think it's not a family problem, and it is a community problem. It is a school problem, and I think we have to work together. In order for it to work, we have to work together.
I think it's gotten to the point where everybody knows about it. Everybody knows heroin's out there. And if they're in complete denial, then they're in complete denial. But everybody knows it's out there, and it's come to the point where, okay, now what do we do about it? Everybody can do something, you know, and everybody needs to do something. You can't just sit on your couch and read the paper and go, that's too bad. You need to do something, you know, and that's what this is all about.
Yeah, we'd really like to help grow the Project Purple
Thank you.
group here too. I was so happy to work with them on the Purple Flag Project last year.
It was, it's amazing.
Great bunch of kids.
You know, it's really interesting. My son and I spoke recently at the Barnstable Youth Summit, We were up here a few weeks ago, and the next day he was at the college in the classroom. 7th graders, classroom after classroom came in. It was just, wasn't there, but I watched all the footage. I had my camera guy film everything, and went back to New York and I watched it. And I was in shock, because even with their teachers in the room, he was just so one-on-one with all of these kids and told his story. And then he said, you know, tell me, how many of you have done this? How many of you are doing this? And they all raised their hands, raised their 80%, 85%. And then he said, now just scream out in one word, why are you doing it? And the kids, you know, you'd have the girls, I'm fat, I'm ugly.
Yep.
And then the boys, I mean, some of the things were, you know, my father said I'm a loser because I'm not an athlete. I'm fat, all the stuff that was coming out. And my camera guy, I said, I can't believe this. And he goes, I never, ever would have raised my hand when I was in 7th grade. And my son, who's, you know, 27, he goes, I never would have either. These kids want to talk about it.
They want to talk
They do.
about it. They really do.
They just want somebody that is willing to listen, I think.
That they can trust, and that's huge. The trust has to be there, because they're afraid of being judged too.
Correct.
So they don't want to come in and spill something to you and then feel like you're being judged, and that's huge. And then it's funny, like you were saying, I think Maya Angelou said it, now that we know, we have to do better. And I think that's huge. It's huge. We can't
And
pretend.
that's everyone. That's not only, you know, people in the medical field that I represent, re-educating themselves
Right.
and being more careful with what we're doing, but educating our patients about safe use and storage of medications and disposal of medications, because many of the problems we're seeing now with the opioid epidemic really is starting in the family medicine cabinet.
It's in the movie. I mean,
Yeah.
there's so many good points in this film.
I think if people will just come out and watch, it's a very short film, it's only 27 minutes. The bigger part of the program really is community discussion. We're going to have a wonderful panel of experts, including people that are sitting here and some others. And with James Wahlberg there, who wrote and directed the film, he's going to talk about what made him write the film and why he made a film a little bit different than some of the others that have been out there in the public for consumption. I think that people will find this is really a worthwhile event to come to, and also to explore a way to maybe open up conversation with your own family members, and really introspection with yourself about where are you with this. Because what parents really need to understand is these are not the drugs of our 60s and 70s that are out there today. This is much more lethal, much more toxic, and our kids are actually being targeted by cartels. The drugs they're putting out there are even look-alike drugs. It can look like a benzodiazepine, Ativan or Valium, and it's really 100% fentanyl. So there's no first time. You do it the first time, you can die. And Narcan is not necessarily going to reverse that, because this drug that's out there is so powerful, people are dying without being able to be brought back to life. So that is the urgency and the sense that I think we all feel. And I thank everybody from warrior moms and warrior sisters and all the people that are out there trying to make this better for somebody else. We really need to stop the loss.
So Thursday.
Thursday, please come, bring the family. It's a short film. I think you'll just find it exactly what you need to start a conversation if you already haven't had the conversation, and to talk to some people in the field about what's going on. Thursday, doors open at 6 o'clock at the Nauset Regional High School. And whether you have a ticket or not, please come. You can pre-register for a free ticket at Open Door.
I don't have it. Lucia has it.
I'm sorry. I think it's opendoor.eventbrite.com. Thank
You
you.
go to the Facebook page.
Yeah, you can go to the Facebook page too and find it. But come no matter what. That's the important thing. We want a nice full auditorium. Thank you, ladies.
Thank you.
Thank you for having us.